Now for next of we'll look at obstetrics, and we'll try to kind of like, in every medical field, what makes it unique is they kind of like coin a language for themselves. Do you understand? So when they coin the language for themselves, there are some things maybe they want to discuss between two medical officers, or between a doctor and some medical students. So maybe you don't want the patient to know, so you can always use those terminologies. Do you understand? Or sometimes you might just want to use those terminologies to look professional. So in obstetrics, that's the physical examination in obstetrics. So a patient came to you, you are taking a medical history, everything. The next is what? Physical examination. So as I'm doing this physical examination for this patient, there are some terminologies that I might actually want to use. So what are some examples of these terminologies? So it just involves what? A range of specialized terms. So they help the healthcare provider to be able to access the health of both the pregnant woman and the fetus. So this will help you in communication, in recording, okay, in documentation. So you might actually use some terminologies like Gravida. This one is the number of times a woman has been pregnant, irrespective of the outcome, whether she gave birth to a live baby or she lost the baby. Para is the number of pregnancies carried beyond 20 weeks. So you're now asking, have you ever had any miscarriage? Then our total pregnancies, how many of them have passed 20 weeks? Last menstrual period, then estimated due date or estimated date of confinement. Then you might also want to use terminologies like fundal height. This one are trying to measure the height from the pubic symphysis to the top of that's the fundus of the uterus. Lie, that's the position of the fetus in the uterus. Do you understand? Presentation, okay, is it the head of the baby that is coming towards the birth canal, or is it back, or the buttocks, or the legs? Do you understand? Engagement, Leopold maneuvers, okay, those ones are maneuvers that you actually do to check the position of the baby. So for fetal assessment, you hear words like fetal heart rate, Doppler ultrasound, kick count. They're trying to see how healthy your baby is, okay, is the baby kicking and all of that. Alright, this is a Leopold's maneuver. I'm trying to feel for the head of the baby, the back of the baby, the buttocks of the baby. Okay. So vaginal examination terms, you can hear things like what? Cervical dilations, effacement, station, okay, then rupture of membranes, okay, or maybe the artificial rupture of membranes where they induce it using all those drugs. So other relevant terms like the Apgar score, this one, immediately you give birth to a new baby, okay, they are trying to access for the alertness of that baby. The non-stress test, Bishop scores, quickening, alright, all of that. Okay, so this is what we have here, alright, for the different terminologies that are used in obstetrics physical examination, to be specific.